832-3680.
Wow, it's that time already. Sunday afternoon. The weekend goes so darn fast, doesn't it? Yeah, it really does.
It changed. The whole the week went by very slowly this week. Weekend blew by.
Yeah, it always does. Welcome to Stages of Life Radio. Sundays live, 4 to 5, right here on News Radio WFLA Orlando, as well as on social media platforms like Facebook and Periscope, Twitch. Why not? Let's play games. And other places, YouTube, you name it. So, Dr. Klein, today I see you want to talk about healthy skin through nutraceuticals. I'm all ears.
Yeah, well what we're looking at is we're getting into the summer months.
Okay.
A lot of people are going to be going to the beach. Bad idea, maybe a good idea, who knows? But they're going to start seeing more and more of you. Shorts, short sleeve shirts, all kinds of showy, let's say clothing that we're going to be looking at. The long and short of it is that the skin, your skin, is the largest organ in your body. You have more skin than anything else. It happens to be that which most people are going to see before they see the rest of you. When I was in general surgery, I used to look at people's innards. And it was always very satisfying to be able to tell a patient after surgery that you're every bit as pretty on the inside as you are on the outside. But that's not always the case. Here, what we're looking at is what can you do to make yourself look better? What can you do to make yourself healthier? So when you sit back and look at different people in different cultures, different locations, different geographical areas, what is it that makes people age at different rates? We talked a little bit about this last week, and we're going to talk a little bit about it this week. Is it ethnic? Could be. Is it dietary? Far more likely. You can actually age yourself, not just your skin, but the rest of you as well, by looking at your diet inappropriately. What do you put, into your system? It's going to make a difference in your general health. That this has been dismissed medically for many, many years. The doctors say, well, all you have to do is eat healthy. You ask the doctor what's eating healthy, and most of them don't have a clue. Well, you really shouldn't eat more, meat more than a couple times a week. Really? Okay, so what are you going to substitute, a soy burger? If you want to poison yourself, there are many ways that you can do it by looking at quote-unquote health foods.
Can I tell you, even my vegan friends know to eat protein at least once a month, red meat.
There you go. Otherwise,
like
they end up with B12 deficiency.
Otherwise, you're going to have some real issues.
Yeah, it is a major problem. So you just don't want to go into this thing, with a philosophical approach to your diet and then suffer medically as a result. So how can you influence your aging? How can you influence your skin health? By what you eat? And the answer is very, very simple. There are medications that you can take that are anti-inflammatories. There are foods that are pro-inflammatory. A can of soda will age you faster than about anything else. A nice, healthy slice of birthday cake. Certain fruits that are rich in fructose are problematic, but so much of the food that we have is just stocked to the brim with poison. The two most common of which, oddly enough, are high fructose corn syrup. Why? Because corn is cheap. Okay, we lead the world in corn production. We use it. We have so much corn here, we burn it as 10% additive to gasoline. We burn the stuff. It's so cheap to us. So they dilute the nutrients in your food with it. And what does it do? It is pro-inflammatory. You go ahead, you overdo it on the fructose. It makes arthritis work. It makes tendinitis worse. It makes neuritis worse. It makes a lot of things worse just simply by inflaming the body's immune system. The inflammatory cascade is fed. It is hypercharged by fructose. How much fructose is in an average can of soda? It's an enormous amount. It's about a third of it is granular sugar. It's a lot of junk, but it does in fact make you sick. Does it rot your teeth out? It doesn't do your teeth any favors. But truly, what really happens here is it will age your skin and you're going to start looking older. There are other things you can do that will contribute to it. Smoking is a beautiful one. Okay, that makes the blood vessels constrict. It makes everything slower to heal, and it makes the skin look older and older and older. Direct sunlight, something that we have an abundance of here in Florida, will age your skin. So what do? You take certain precautions. I'm wearing a shirt right now that actually has an SPF protection to it.
Me too.
It costs an extra $6.
Yeah,
wouldn't you know?
Right.
And so does it help? And the answer is yeah. I went for my annual dermatology lookover. There's sort of a demeaning kind of a thing to be standing there in the buff while somebody looks you over inch by
Hey,
inch.
it's worth it, man.
It is worth it. And so, my skin is in pretty good shape for a person my age. I had one little, ditty that they decided, well, if it's boring your wife, we're going to take a biopsy of it. So that was done. And more so, sugar is also what's called comedogenic. It makes you break out. Just what you need to be is 50 years old and having acne, but that's partly from what you're eating. So enough beratement, enough aggravation from the doc. Yeah, I know these things are bad for me, but I just can't help myself. Yeah, you know why? Because that same fructose is the most addictive substance known. It is interesting. It will, in fact, by itself inhibit the insulin receptor. So not only is it going to put weight on you, but it's also likely to make you diabetic. So we were looking at one of these medications new to the market for, that'll help, quote unquote, help with diabetes, and it will knock some weight off you as well for $1,300 a month.
I get a personal trainer and personal cook for that a month.
Oh yeah, well, in certain parts of the world, you can get a heck of a lot more than that. $1,300 a month. Okay, for $10 a month, you can go to the gym, right?
Yeah, well,
that happens a lot, doesn't it?
Yeah.
Okay, the likelihood of Medicare covering that stuff is about zero. Okay, my wife's Aimovig for her migraines. Blue Cross won't cover it. All right, so $800 a month for something that's life-changing. This stuff here is unlikely to change anybody's life.
But I bet you $1 someone's going to text in at 23680 and say, "What's the name of that, Doc?
There
What's
we go.
that stuff?
Yeah,
you got me a script."
Right. Okay. So, what is the hidden secret? What is the secret?
There's
Doc?
no secret. Healthy
there is no
eating,
secret.
healthy skin.
There's no secret. What little secret there is to this is not a secret. Okay. So, what is it? Number one, oil. Oddly enough, we sit back and we know that about a third of the population has constipation, severe constipation. If you loosen the definition up a little bit to what's just unhealthy, it's about 2/3 to 3/4. Not enough oil in your diet, you don't poop as frequently as you're supposed to. But any 4-H kid, any high school kid that has anything to do with agriculture and gets into competition, dog, cat, cow, whatever, knows this. That if you want your critter, if you want your piece of cattle, your dog or cat to look better for show, you put olive oil in their food.
You stop feeding it corn-based food.
Yeah, what you do is you give them oil, and what that does is it makes the skin look better, the fur will start to shine, and wouldn't you know it, your skin and your fur are going to shine too if you kick up your oil content. It's necessary for skin flexibility, it's necessary for heart health, a bunch of different things. So the omega-3s are what we typically focus on, but there are many more oils other than those. Some of them are very, very good. Some of them are miserable. Coconut oil is one you ought to throw away. It's not even useful as a lubricant, frankly.
People fight me about that, too.
Let them fight.
Coconut water as well,
it's
useless.
Garbage. No, it's bad news. Okay, why? Omega-7s, are what you find in coconut milk.
Yeah.
Okay, you know what? Funny thing about omega-7s, if you take enough of them, especially if you're one of these keto beasts, I'm going to go out there and stick bacon, juice or whatever, bacon fat in my coffee. These individuals,
just a stick of butter.
The omega-7s make you smell like an old person in a retirement community.
Yeah,
the omega-7s.
I smelled it the other day where I was in a line and was like, "You're on a keto diet, aren't you?"
There you go.
Gosh.
Yeah, you can smell
bad
it.
Fish.
Yeah, and then the vitamins, minerals, and free radical scavengers. And we can go over all of these things individually. But the long and short of it, is that your diet is important for you up front. Why? Weight is important. It's an attitude, a lot of different things. But when you start getting right down to the supplements, typically what you do is you want to look at a proper multivitamin. Minerals are important. The omega-3 fatty acids, something called folic acid, and hyaluronic acid. If you do these things in terms of ingestion, in other words, take them as capsules, you are going to do well. Now, the last one actually is topical MSM, which is a free radical scavenger. And we'll go over the different pieces of this after these important announcements.
Ooh, look at you.
Whoa, the timing. The old man's getting it.
Yeah. 23680 if you want to text in some questions for the doc. Give us enough information to work with if you're going to do that. Hey, I don't
and watch
feel
the
good.
abbreviations.
Bing. Yeah, really. It's very difficult. Anyway, we'll talk a little bit more about skin, then we'll take some phone calls, etc., etc. And that line is 407-422-1212. You're listening to Stages of Life Radio. Check out stagesoflifemedicalinstitute.com. We'll be right back. This is News Radio WFLA, Orlando. Hey, look at that. I need to go yell at Loudmouth out there. I don't know if you could hear him.
I can't hear. I can't hear anything out there.
No, actually, I won't do that because the phone's ringing. I'll let her do her job. Maybe that was why she was being so loud. She was talking to somebody who was elderly on the phone. And that probably was it, now that I think about it. Yeah. What's your what? Hello? Yes, this is Stages.
Turn down your radio.
No, listen to the phone. Oh. You would be so surprised. So we'll go.
You're describing my patients now.
I know I'm describing some of your patients. I've been in your waiting room. Oh, honey, sit over here.
That's not a chair.
Shuffle. No, this is not the bathroom. Ooh, I'm serious. Your people aren't all that. Oh, sometimes your waiting room is a little.
Actually, we've got a pretty good crew of patients. Yeah. You know, every once in a while.
We got a few that have slipped through the old crack.
Every once in a while, we have the bus show up. So
let me see how we're doing for time. Oh, we're close. All right. Yeah, only like very quick breaks today, so I figure we'll take advantage of that by not feeding any extra stuff in there. Get all your minutes and then some.
There we are.
All right, so if you're listening or watching us on Facebook, hi guys, thank you. We're across a couple of different pages on Facebook. We're also on Twitter, a couple of pages there too, and I think, like I said, on Twitch, which is a gaming platform, but why not?
This is the only game in town.
All right, hello, how you doing? So I hear music peeling up in here. Here it is. Who is it? Oh, look at that. Look, Gladys Knight.
They're here.
Neither one of us wants to say goodbye, so we won't. We'll just join the radio crowd and take care of business like that. What do you think, Ken?
I think so. I think that'd be just the thing to do.
I'm a pip.
I'm Gladys Knight.
You are not.
Cultural appropriation.
Hey guys, welcome back to Stages of Life. You never know what you're going to walk partly into when you tune into this show. What were they talking about during the commercial break? Well, here's what you do.
Anything good.
Dr. Dave, come on now. We're also on social media, so if you're just driving down the road and you're like, darn it, I'm sitting in my driveway, this stinks. Well, either take us inside on iHeartRadio or watch us on Facebook or Periscope or whatever. Just search Stages of Life Medical Institute. It all makes sense.
It's simple.
It's what we call branding, baby. Stages of Life Medical Institute. You pop that into any search engine, and I guarantee you this is going to pop up.
It has been recently.
It really has. It's working. Yeah, so good. So we're in the middle of talking about keeping your skin healthy and how you can do it with nutraceuticals. Yeah. You already told us what not to eat.
Yeah. So what we want to be looking at, okay, simply enough, you start off by looking at the greater picture, the bigger picture of the patient. What else is bothering you? Well, everybody wants to look younger. Everybody wants to be healthier. Everybody wants a lot of things. What are you willing to do? What are you willing to give up to get there? What can you give up, and what can you do about this? There are people out there that just simply want to take a pill and walk away. Well, wouldn't it be easy if you could? You can't. It's like education. Wouldn't it be nice if I could read one little book and know the material for that course, be able to pass the test with flying colors? So it doesn't really work very well. So it starts off with personal responsibility. You need to make sure that you're not overeating. One of the funny things about caloric intake is that it's inversely proportional to your longevity. What that means is the more you eat, the shorter your life is going to be. Interesting business. I kind of learned that the hard way. One of my best friends, I was a pallbearer for his mom's funeral, and she was obese. I mean, she was a big, big lady, and that damn near killed me. Carrying that casket across the lawn.
With you and
so it's short,
5 other big guys?
Yeah, no, it's like 4 of us.
Oh.
So yeah, she didn't have a lot of friends. So so her obesity, cost me a terrible backache for weeks.
Oh.
So your obesity doesn't necessarily hurt you alone. So what else do you want to look at? We want to look at your hormone levels. It shouldn't come as a huge surprise that you can maintain a pretty decent weight up until you're about 25 years of age, and then all of a sudden you start gaining 3 or 4 pounds a year. and then it turns to 8 to 10 pounds per year, and it accelerates as you get older, and then pretty soon you look at a piece of chocolate and you gain weight. So the sorts of products that we use for this purpose, and we try to keep it as simple as possible, because the more complicated the regimen, the more difficult it is to do, the less likely people are going to be able to do it, and the more effort it takes. And a lot of people don't like to put in very much effort. We have many of the most motivated patients I've ever seen. They really want to get down and get it done right. But we have also a number of folks that just simply want to find the cheapest, easiest, and the least aggravating way to do anything, which means that I'd like a shot right now and have it work all year. So we developed a product called Down to Basics, okay, which I believe is probably the best multivitamin mineral combination you can find. And it's inexpensive. Okay, kind of odd, isn't it? You can go and talk to some of these multi-level marketing people, and it's going to be between $50 and $80 a month. We have it for $22 a month. If you go on these recurring order things, it's about $20. Pretty cheap. The omega-3 fatty acids. I was looking at a can of sardines today. Mm-hmm. Okay, they're one of my favorite foods of all.
We're not allowed to eat them anymore. Don't ruin it for me.
I love it. Okay, well, today, special day, so I ate a can of sardines. 2,000 milligrams of omega-3 fatty acids. Okay, in a whole can of sardines. A can of sardines costs about $2, right? So 2 capsules of Heart and Soul, which cost about 80 cents, 60 cents, that range. Not nearly as many calories involved. And wouldn't you know it, it gets you the same omega-3 dosage. You need to have the omega-3s, but there are other oils that you need. Now, you want to be taking the oils to the extent and to the amount necessary for you to defecate, that's poop, 3 times a day. Now, your mom may have told you you're doing pretty well if you can poop once a day. In our society, that's true. Once a day is probably what the average healthy person does in this country. But really what's supposed to happen is you're supposed to hit the commode after every meal. It's called a gastrocolic reflex. When you've done that, you know that your colon is emptying, and you're not walking around like a suitcase with fecal material. Ew. It reduces your risk of cancer. It reduces your weight. Okay, oddly enough, and it keeps you a whole lot healthier. It's something that you want to be doing, and you can do this with a shot of olive oil a day. One little shot glass. Pretend it's something else if you have to, but a shot of olive oil. I prefer fish oil. Folic acid, high-dose folic acid is the most cost-effective, and it's a detox. It's the cheapest detox you can get. It's $4 a month. What does it do? It lowers cholesterol. Reduces the plaquing in your arteries. $4 a month. It's pretty reasonable. Hyaluronic acid. What does that do? It's for skin flexibility and joint flexibility. Not expensive at all. And then we use Kinky's lotion. Why? Because I invented it. It's nice to be able to say that. But it's also very inexpensive. You apply it on your skin, and your skin starts to pink up. It starts to look good because the blood vessels start to dilate. So there are a bunch of things that you can do. None of these are expensive, and cumulatively, they're not expensive at all. Or you can get old, gradually and allow yourself to slip away. It's best to die an attractive corpse. Okay. So what are we looking at? We're looking at, really just paying attention to the basics. There's nothing more to this. Multivitamin mineral, fish oil, hyaluronic acid, high-dose folic acid, and a free radical scavenger for the skin. And the Kinky's is a good one because it's a lot less expensive than many of these vitamin E containing products. You simply could not afford to do this from stem to stern, top to bottom, and sideways. It's not going to happen. Kinky's is cheap stuff. So what do we have in our question?
Oh.
What have we got?
You want to know? We got George on the line.
George! God, my favorite person. Actually, he's a pretty cool dude. George, what you got going on there, my friend?
Hey, Doc. I want to ask you, is berberine good for diabetes?
Yes, sir. Berberine is interesting. The herb is called berberensis. There are 5 varieties, one of which is particularly good for lowering blood sugar, lowering insulin, which is a good thing to do, and then lastly, it lowers triglycerides. Now, lowering triglycerides is very difficult to do in most individuals. They say, well, you need to take Crestor to do that, rosuvastatin, and that lowers it about 10 to 15%. Doesn't lower it enough to make a difference, but berberine does. The way you dose yourself with berberine, so George, you need to jot this down because I have a suspicion you're going to give it a try, is you start off with 2 per day, but take it with your meals. Take it with breakfast and dinner because if you take it too late at night, it will give you heartburn. It's not doing any damage, but if you take it with breakfast and dinner, it won't be a big problem. Then you wait until your next lab work. Okay, and if your triglycerides go to normal, you're good to go. If your blood sugar drops off 20 or 30%, that's the right dosage for you. If it isn't, you double the dosage. You take 2 twice a day. If you go too fast with it, it will cause, again, heartburn, but it can also cause diarrhea. Now, here's the joke, George. The diarrhea is actually a good thing, because when you see the diarrhea, it means that you've hit the dosage. It's temporary. Yeah, you nailed it. So I usually tell people, if you get diarrhea, I want you to do 2 things. One, don't call me. And the second thing is continue to take it, because what that implies is that your insulin level dropped sufficiently that your gut is unhappy and it starts to purge. So is it a good thing, George? It's a great thing. That's how you start with it.
Yeah, and berberine, by the way, is not spelled B-U-R-R. I just want to let you know it's not berber. It's B-E-R-E.
B-E-R-B-E-R-I-N-E. Berberine.
B-E.
Bear.
All right. So let's see. We have someone on the text line who said, "Hey Doc, that's my mom you're talking about."
That's your mom.
I guess you're talking about your
wife.
Tess?
Oh, okay. Yeah, well.
Careful, that's my
mom. I got to be careful.
Yeah, 407-422-1212 is the number to check in with today.
Oops, the family's listening in.
If you have a question for the doc, we'll try to keep it clean.
Mom.
That's my mom you're talking about. I'm thinking some really bad jokes. I know, it's so bad. Anyway, and 23680 is the text line if you want to check in there.
Busted.
And yeah, you might as well. Why not? So, skin stuff. Now, you mentioned all these nutraceuticals and whatnot. And where are they available?
Well, okay. The Down to Basics is something that I put together. Okay, so you can find that at stagesoflifevitamins.com. Just simply type in down, D-O-W-N, and it'll pop up. Now, there's 2 of them. There's one that says Down to Basics without iron. There's one that says Down to Basics with iron. Get the one without. Okay, too much iron in your diet will actually be very harmful to you. It's pro-inflammatory, cause all kinds of problems. The only time that I use this is if somebody has an iron deficiency anemia. Okay, if that's you, then that would be the right product. If not, it would not be the right product. Or young menstruating females, because they're almost always in need of iron. All right. So if you're between the ages of 20 and 35 or thereabouts, the with iron's a better product. The rest of you, unless you're walking around pale.
Now I figured out who it is. The mom in the coffin.
Oh, ooh, ouch. Yeah.
The other nickname was 2 Tons.
No. She was very nice.
Okay.
But heavy. Yeah, I mean, it took me months to recover from that.
That's so wrong. 407-422-1212.
Yeah, that was a call from Virginia.
Yeah, I was going to say, you must be listening on the iHeartRadio
Sorry,
app.
Yeah, but obesity is a terrible, terrible problem.
Really?
It ages you prematurely. It's associated with about every chronic disease that you can get. Mm-hmm. You don't see too many people live into the 90s that are morbidly obese. It just doesn't happen.
Yeah. See, that medicine that we were talking about earlier, I knew that was going to happen. The Wegovy is what it is. Yes. It was approved. Semaglutide.
Yeah. Well, what it is, it's the Ozempic, just in a higher dosage. Mm-hmm. Okay, so what does this mean? It's an injectable.
Right.
Okay, it's associated with a laundry list of side effect problems that ought to make you blanch.
Yeah, I was going to say.
And the fact is, it's $1,300 a month, and nobody's insurance is going to cover it.
Not a one. No.
Why
And
can't you
what's
do
the
the
other one?
prior auth?
Ozempic is that's about $850 a month without insurance.
Yeah.
Same. Long and the short. Try eating better and exercise.
Yeah, just cut the crud out of your diet. How about let's start there?
Okay.
But I like fruits, nuts, and candy.
Fruit and nuts. Nobody eats fruits and nuts if they're eating candy.
Oh, yeah, they do.
They fast food and junk. And make sure
Yeah,
I get that apple
It's nothing
pie.
like caramelized walnuts. I'm sorry.
Oh, stop. We'll be right back. It's Stages of Life Radio. Oh, my God. What the hell happened there?
I thought I hid those in the freezer.
No, you did not hide the caramelized walnuts. No,
You're with the caramelized walnuts. Also,
well, she puts them on this special salad, this very healthy salad, and then she puts these caramelized nuts on top.
They do that. Or the what is it? The the cranberries that are the craisins or whatever, the cran
Oh,
raisins.
those will jack up your blood sugar too.
I'm like, oh, these taste good. They must be bad, and I was right. Like this wonderful field greens kind of a thing going on.
Yeah, you want to see the least healthy people in the world?
Vegans?
No. You go to the health food store. Okay, go in there, and it looks like The Walking Dead.
Oh my God, their skin color alone, that they're so gaunt. And
You look healthy there, Mildred. She didn't answer. You look healthy there. She's dead. You know what I mean? She's dead on the dairy aisle. No, it's just the way that it works.
No.
Well, gee, this is organic.
Ooh.
Like the other food here is not organic.
Well, we had a really good question for once we come back from the break. So, let's see, what time is it here? We got to check our checks and balances.
Checks and balances.
32:16. I was so close. No, I can never do the math right. Ever. You notice that? It's not me. I was just talking today to somebody. I was like, yeah.
There's 60 seconds in a minute. That's really what the problem is.
I can do that.
Yeah.
I can back time.
60 seconds, 60 minutes.
That's the first thing I do is count backwards. I can count change like a demon, though.
You don't even need to anymore. It's all done for you automatically.
Refuse.
Yeah.
I will make it difficult. What? It's $19.64. Okay. Here's 25.
Exactly.
And then, and 16.
There you go.
90, huh? Welcome back to Stages of Life Radio, Sunday afternoons, 4 to 5 p.m. Eastern Time, here on News Radio, WFLA Orlando. I hadn't actually introduced myself. I said who you were, and everybody knows you're Dr. Klein.
Well, they all know who you are every morning.
Do they? Do they? Melissa Fox
the
here.
Voice of Orlando in the morning.
I was counting it, and I host this show with you, medical show. I host a real estate show. I host a banking show with Trustco Bank.
Yeah, you're responsible for all of this real estate being sold in the state.
It's my fault.
I know.
And I also host a relationship show. And I was like, wow.
Well, that explains the divorce rate.
Pretty well rounded, yeah. So we have a question off of our wonderful text line, 23680. No, I asked. I said, make sure you give me enough information to work with.
Did
right?
they?
Yes.
Oh, good.
Here's the deal. This one says, I had polio as an infant.
All right.
Sad. Now, 63 years later, I am suffering from classic post-polio syndrome.
Sure.
Including fatigue, muscle and joint aches, shortness of breath, etc. Do you have any recommendations for people suffering from post-polio syndrome?
Okay, first thing you need to look at when somebody comes in with post-polio syndrome is there really isn't anything that's post-polio syndrome. There are a lot of things that can happen as a result of an accelerated aging process. So my favorite post-polio patient was a gal who came in a wheelchair, okay, otherwise healthy individual with terrible, terrible shoulder pain. And, well, I was told I had post-polio this and post-polio that. And what I did was I found that what she had was a simple tendinitis of the triceps musculature in her shoulders.
Was
Why?
it getting aggravated from the wheelchair?
Yeah, it was simply from wheelchair ambulation.
Why was she in a wheelchair, though?
Because she had polio as a child.
Okay,
so she really couldn't put it together.
Got it.
So we applied an anti-inflammatory to the shoulders, and wouldn't you know it, the post-polio portion of it went away. Mm-hmm. So you have to look at the individual with the history. So when you were a kid, when you were an infant and you had this, it'd be really useful to know what segments of the body were involved. Was it the shoulder musculature? Was it the pelvic musculature? It's more common in the lower than the upper, but you can see it in multiple areas. So is it going to cause shortness of breath? The answer is yes. Why would that happen? Because the muscles of respiration are not just simply the diaphragm, but the intercostals, but as well as the accessories in the neck and shoulder. So there's some things you can do with physical therapy. If you're Brit, you may call it physiotherapy, to strengthen those muscles and or deal with something that's called a spinal withdrawal reflex from the pain. So if you have a levator scapula tendinitis that's causing your pain when you shrug your shoulders, you're not going to breathe as deeply. You can have a problem with perhaps the 11th cranial nerve. That, in fact, will also cause shortness of breath subjectively. So if you do a pulmonary function test and find out whether you really are, in fact, short of breath or whether it's something that you're perceiving. Ooh. Okay? So there are a bunch of things you can do. It's a cool problem. Is it a challenge? Not particularly. Are there things that you can do nutritionally? The answer is always. Mm-hmm. But the main issue here is going to be strengthen the muscles that you still have, because they're not continuing to deteriorate. The poliomyelitis is something that came in when you were a kid. By the way, poliomyelitis is one of these sorts of things that you ought to go out there and talk to children, talk to the parents at the PTA or whatever they call it these days. This is what polio looks like. Because when I was a kid, you'd go along, and then all of a sudden there'd be an empty seat beside you, in school. Okay, and little Johnny, little Jane, whomever would never come back. That was the end of it. And the vaccine that came in, we stood in line. Those lines were a block or longer to get these vaccines, knowing that 1 in 10,000, 1 in 20,000 kids is actually going to get polio from the vaccine. And here we are. Okay, we have a pandemic. We're in the second, and we are now in the year 2 of pandemic. Okay, in the year of the plague. And we have people that are still not getting the vaccine. I don't get it. I've seen enough pandemic. I have seen enough infectious disease to be willing to take that small, and I do mean minute, risk with this vaccine in order to stay alive. So what do you think? So he's worrying about, I guess it's a he, worrying about post-polio syndrome. What do you think the post-COVID symptoms are going to be like? What do you think the post-COVID diseases are going to be? Post-influenza, something called von Economo's encephalitis, was a big deal. Most of those people that got the influenza of 1919, those people have long since passed away. But back in the 70s and 80s, we were seeing individuals with what looked like pre-senile dementia, sometimes known as Alzheimer's, as a result of influenza that had been suffered 60 years earlier. What do you think we're going to see from this? I have 2 patients in congestive heart failure from COVID, one 15 and the other one is 72. Post-stroke, if you want to have some fun with this, and if you're familiar with doing really good research, go on PubMed, pubmed.gov. You paid for this in your tax dollars. pubmed.gov. That's National Library of Medicine. And look up COVID, leave a space, put a plus sign, and then write something along the line of stroke or cerebrovascular, and see what the incidence is of stroke following COVID. And it's incredible the number of articles that have been published on it. These are peer-reviewed articles, not the silly blogs that you see when you do Google searches. Well, so go out there and figure this out, because the only way that we're going to really make it through this mess is that if more people get the vaccine, because the 50 or 60% that have already received it, we're watching the country open up. The other 40%, a certain number of those people are going to do badly. So the dying isn't over yet. Just remember that. The dying isn't over.
Wait, I got a multisyllabic one for you here.
Oh, go for it. Okay, enough raving.
Thromboprophylaxis.
Thromboprophylaxis. That is what that word means is preventing blood clots.
Right, and they're saying that is they're worried about anticoagulation and acute stroke in post-COVID patients.
What happens is that they're accept this, that the strokes that people are having are not these sorts of hemispheric strokes that you typically see that are thromboembolic events.
Gotcha.
They may be brainstem. You see those more typically in diabetics. These are inflammatory. These are vasculitis type processes. So how do you treat it? I'll tell you how I do it. Okay, I treat it prophylactically with turmeric, which is a tumor necrotic factor alpha antagonist. It helps with vascular inflammation.
Is that the spice tumor?
Yeah.
Now,
imagine that.
Isn't that also an anti-cancer?
Yes, that does a whole bunch. Anything that's anti-inflammatory is likely to be anti-cancer as well.
Look at that.
So there are people out there say, well, if you take naproxen, it's anti-cancer. Of course it is, if you don't kill your kidneys and your stomach first. So there are many things. There are 2 edges to this sword, right?
Okay.
Actually, this sword has about 6 edges.
Yeesh.
So you just have to rely on your doctor.
Nice.
Your doctor will take care of you.
Okay. Now,
except on Wednesday afternoons when they play golf.
Yeah, that's no good.
Yeah, I hate that.
Bueno. Some people, here's a text. Some people have lost faith in Dr. Fauci. How about you, Dr. Klein?
I never had faith in Fauci. Okay, let's understand how this operates. Okay, he's been in government longer than most of our listeners have been alive.
Yeah.
Okay, this guy is the penultimate, politician. Okay, he is in a political position appointed by politicians, and he's there to say what's politically correct. This guy hasn't treated a patient in many decades. So what do I think? I think somebody that's made that many mistakes, okay, needs to be taken with a grain of salt, which, by the way, is enough salt.
Yeah, grain is enough.
Grain is 60 milligrams.
Fair
right?
enough. Okay. So Fauci is a no bueno. Gotcha.
No bueno.
Let's see. Rick from Altamont, you got a question about the J&J vaccine. How you doing, Rick?
All right, got a couple of questions.
Sure, what you got?
At the J&J about 7 weeks ago, and didn't get much reaction, just a little sore. First question is it okay to go to a restaurant or to go out?
Okay, well, it's an interesting question. The most likely place that you're going to get COVID is going to be a restaurant. Okay, and this is the way that it works. Because in my humble opinion, and I will in fact disagree with Fauci on this one, and I will be right. Okay, is that it's largely obtained. You largely contract this disorder by what you eat and drink. It goes into the mouth, hits the gut, and that's how you're likely to get it. So why is it, okay, that you're likely to get it at a restaurant? Because if the people working in the back of the restaurant, preparing your food, cleaning your dishes, and folding your napkins, if those individuals are not as clean as you hope that they might be, it increases the likelihood that you're going to get it. What you want to do is to drink hot beverages, eat hot foods, and if I were you, I would very, very subtly wipe the silverware off with your napkin before you use them. Then you should be okay. Now, I'm not a big Johnson & Johnson guy. The J&J vaccine is only effective about 2/3 of the time, where the Moderna and the Pfizer are effective about 97% of the time. Now, I've been doing my own research, not to be confused with a Google search, and that's I've been doing my own quantitative IgG levels looking at COVID-19 antibodies. And what we're finding is that people that get the disease end up with a level of between 6 and 8, sometimes as high as 20, but rarely IUs of the antibody. When you get the Moderna and Pfizer vaccines, it goes to 20 to 60. Those people with the Johnson & Johnson, they're the only ones that we've had so far that have had no, many of them, not many of them, but enough of them have had no antibody response at all. Yeah. So I'm not a big J&J guy. No, were I you, I would get the antibody levels checked. Right. That's not a positive or negative. It's how much do you have. We do that at Stages. It's a $49 test. You are not talking serious money here.
Right. You mentioned before, though, about Johnson & Johnson's vaccine. You were just like, at least they're getting a vaccine.
Yeah, you know something? It's a minimum. But if given the choice of doing it right or doing it wrong, you did not choose doing it right. So, but I only want to get poked once. Well, you know something? I would have enjoyed only being poked once, but I went and got the Moderna because that was the one that I chose. My wife, she got the Pfizer. Mm-hmm. Okay, so neither one of us ended up with much of a reaction. Our arms ached a little bit. After the second dose, I felt like I ran a marathon for about 30 minutes.
Hey, wasn't bad. When we come back, we got a question from Bob about thin skin. Is it radio thin skin, or are we talking about actual thin skin? Because there is a difference, Doc.
Well, it all depends on what names you call me.
Yeah, see? There you go with your thin skin again. You better toughen up, son.
I will toughen
Seriously.
up.
Phone's open also, 407-422-1212. Thank you for participating. We'll be back in just a moment. Text line 23680. This is Stages of Life Radio. Sundays 4 to 5 right here on News Radio, WFLA Orlando. Wow, this is a really quick break.
You gotta love it.
Yeah, I know. Right? I don't have enough time to turn this around.
Push the buttons.
You hush. Right. Yeah, literally, it's a minute break. And
Well, that is not within my union contract.
It's even better. Your union contract.
Yeah, I was actually denied entry into the engineers union when I was at WWDC.
Well, you didn't have a big enough belt buckle or gray flannel pants?
Well, I didn't know anybody in it to sponsor me.
That'll do that also.
So my first radio gig was at WWDC.
Oh.
Silver Spring, Maryland.
One of my first gigs for TV got sent out to cover a KKK rally.
Really? No kidding?
Yeah.
Undercover?
Yeah. No. No.
I couldn't resist. I'm sorry.
It's okay. It rained, and there were a whole bunch of black reporters there. It was really funny.
They were all undercover.
They couldn't get their cross-lit. They're like, damn it. Damn it. Stupid rain. True story. Uniontown, Pennsylvania. Hey, everybody, welcome back. Wow, that was the quickest break. Did we actually take a break?
I don't know.
Who knows?
Tempus fugit.
See? Huh?
Time flies. Latin.
In Latin. Yeah, I knew that. I think I did know that, actually. I just didn't hear how you said it. But tempus, yeah. I know
Tempus.
that. Tempus fugi. Time is flying. All right, welcome back. How are you? We got questions to handle. We got someone calling in on the phone here, which we're screening as I speak. Wow, we've had a lot of good questions today. I like the Fauci one. That was fun.
Yeah, really.
It came out of nowhere. I thought, okay.
Well, everybody knows the guy is not all there. I mean,
He's staging.
how many different mistakes can one person make
It wasn't mistakes. He
and
was
still get paid more than the president?
staging manager. This is
Yeah.
the highest paid government person
Yeah.
in all of
I
government.
mean,
It's ridiculous.
actually, he should be paid more than Biden.
Well,
However,
come on.
it is the short bus.
That's a very short buzz. Okay, so anyway, all right, we got 23680. How do you remove an inheritor's name from a trust? Nope, wrong show. Wrong show. Okay.
Yeah, go to your lawyer. I know a good one.
I was trying to call the home improvement show, but I got no answer. No, that's...
The trust improvement show.
Right. How do you prune your fig trees? Doc, don't you dare.
I was going to get there.
Don't answer. It's all good. All right, so we were talking... Oh, here it is. Bob says... I knew I had a question. Bob is asking, what causes thin skin?
Okay.
And can it be cured? Now,
It can be
I like pork
controlled.
rinds.
It can be controlled. Thin skin. Okay, so what is it? Why do you get thin skin as you age? And the answer is very simple. Your testosterone levels decrease, and the muscularis layer within the skin and the blood vessels tends to diminish as a result. So you just maintain, if you can, you maintain a pretty good testosterone level. That's men and women, and it should, over the course of several years, really is what it takes to do this, it'll start to get better. So I prefer to be aggressive with testosterone levels. And there are a few other things you can do to speed it up. There's an herb called horse chestnut. Now, what horse chestnut does is it tightens up the veins and arteries in such a way as to help with things like varicose veins, spider veins, but also it will toughen the skin up a little bit as well. Is it expensive? It's about $12 a month. It's not very expensive at all. It's actually less than that. I think we have bottles of 100. You take one per day. I think it's $13. So it's not a lot of money. The testosterone is a bit more, but you really do need to be seen by the physicians to do that. So that's how you do it.
All right, that's simple enough.
Now, one thing that's actually kind of cool for women.
Women,
it's kind of interesting, and this is if you let's say that the skin on your hands and the skin on your feet is kind of gnarly looking.
Ew.
Okay, I had a plastic surgeon buddy up in Canada who used to call it crypt keeper hands.
Ew.
Okay, you can use topical progesterone on that, and it'll make the skin look better, and it takes just a few weeks. So topical progesterone, usually it's about 0.2%. The dosage is 20 milligrams per application, and that will, in fact, start to work.
All right, we got Sam on the line. Sam from Orlando.
Brother Sam.
Sam, don't be scared.
What's the matter, Sam?
Sam, why are you scared? You won't talk.
Well,
Come on, Sam, tell us why you're scared, dear. Sam.
are you speaking to me?
Yeah.
I am speaking to you, sweetheart. Why are you fearful about getting the vaccine? What's wrong?
Not coming through very well. I'm sorry.
Okay. Now, so you say that you're fearful about getting the vaccine.
I'm concerned.
Okay, that's better.
And there's so much we don't know. And the thing I'm wondering about is I've been taking a lot of vitamin D and vitamin ascorbic acid and other things and boosting the immune system.
What makes you think that boosts the immune system?
Easy. Don't be mean.
Well, it's
What makes you
one
think
of
it
the
does?
things that's recommended to have a good level of vitamin D.
Yeah, recommended. Okay, here are the issues. You're looking for easy, you're looking for inexpensive, and you're looking for what you believe to be risk-free. Most people really don't know enough about this to be able to make those judgment calls. Vitamin D3 in sufficient dosage reduces your risk of cancer by about 50%. So vitamin D deficiency will lead to immune system issues. So it doesn't do anything to stimulate the immune system, but a D deficiency will cause the immune system to become impaired. So you ought to be taking
and I've monitored I have monitored in the labs that I've had taken over the past year.
Yeah.
Have been around 60.
That's perfect. That's great. But that's not going to keep you from getting COVID. And you can take vitamin C until the cows come home, and it will not keep you from getting COVID. Now, the vaccine won't keep you from getting COVID. What it will do is it'll reduce the likelihood that you're going to get very sick with it. It'll reduce the likelihood you'll end up with side effect issues from the virus that can cause great harm to you. You know, my wife and I both came down with COVID. Now, I took vitamin C, I took vitamin D, and I can promise you that your vitamin and mineral regimen was not nearly as strong as mine, not even close. And yet we both came down with it because we both ate at the same restaurant, ate the very same sandwich. We cut it in half, split it, and 2 days later we were both down for the count.
And weirdly, they were here the third day.
Yeah, exposing the entire radio staff to it.
And none of us got it.
Correct. Okay, that's just the way it works.
It's just how it works.
All right.
Exactly.
So the only thing that will really give you protection is called a vaccine. Now, when I was a kid, we had problems with polio, and the only way to keep from ending up like President Roosevelt did, was to get the polio vaccine. You don't hear about people getting polio anymore in this country. No. Imagine that.
I took the sugar cube.
So did I. So you're my age.
So
okay.
Don't be afraid of this vaccine.
But do you realize that the risk of that sugar cube, which was an attenuated polio virus, was 1 in 10,000 kids were going to come down with a substantial case of polio from it. And yet you took it. And why? Because there was a much bigger risk to not do it.
So that's the same here.
Yeah. What about things like a shingles vaccine? Okay, you want to.
Well, I've had shingles. Yeah.
So have I. I've had shingles
it's horrible,
too.
Isn't it?
It's a terrible problem. And you know something.
Don't want it again.
You have a reasonable expectation to get it again.
Right,
by the way,
you should get a shingles
vaccine. You get
vaccine
the shingles
as well.
vaccine. So why is this any different?
I guess because it's not been.
No, it's they've
No,
all
I know a lot of people who've gotten really sick after the second shot. In fact, one of my neighbors just felt her husband thought she was going to die. She got so sick after the second shot.
How long did that last?
Is she dead?
3 days, she said.
Okay. Generally speaking, people feel crummy for a day or so.
Yeah,
you
I felt
take a
crappy
break
for a couple of
days. But
days,
I'll tell
too.
you what, when I came down with COVID, I felt pretty crappy for about 3 weeks.
You know, what was it you said the other day? You said, Sam, this was interesting. He said, get the vaccine, and you might get a little bit sick. Don't get the vaccine, you might get a lot dead.
Yeah, it's just the way it works. You decide what you want to do. The wealthiest man in Seminole County just died of COVID last weekend.
Yep.
He did not get the vaccine. A
Refused.
billionaire, is now in a box as a result. Okay, so
Let me ask you about ivermectin, because there is a lot of information that ivermectin has been successful.
Yeah, and here
Have
it is.
you talked about that?
Here it is. You're talking about something that has actually not been tested, and you're going to put your money on ivermectin, but not on something that has been tested inadequately in your case.
It's not been tested for COVID, but it's been used successfully by the doctors in the care.
For parasites,
Sam,
for God's sake.
Sam, you do know that the COVID vaccine has been and COVID virus has been around for many generations, and they've had a vaccine that's been used on animals that are very similar
For 20
to us
years.
For at least 20 years. I think it's more like
Yeah,
30 years.
I've been testing for COVID for 3 years before the COVID-19 came out, because we were testing for COVID because it's one of the causes of the common cold.
Are you saying that the vaccine is the same as the prior generations?
No, it's an improvement over. But the Johnson & Johnson is very similar to the ones that were used earlier. Okay, so if you want to go ahead and get the J&J one because you think that's a better idea, then you go do it. You have choices. There's a reason why there's more than one choice out here. But what you're doing is you're doing your research on social media. Ivermectin is the one thing I wouldn't do.
Get the vaccine.
No, actually, I'm not doing it on social media.
It sure sounds like it. And the upshot of it is that I get into this with patients every day. Every day they come back and they think that they have a little bit of knowledge and they start making decisions. But the problem is if you make the wrong decision, it's a 1% chance of being dead.
Sam, we're really glad that you called in to try and get the correct information. And if you do pass it along in your circles, that's also very helpful, as well as people who've been listening to the show and are still hesitant because they think the baby's, dead baby's vaccine or whatever the
it's
goofy
nonsense.
rumor. Stop.
Yeah.
Please stop. Go out there and get it. I mean, we're still alive. I ain't dead yet.
Yeah, I have mine, and I'm planning to get the booster in the
Yeah.
fall.
Yeah, and probably should, yeah. So anyway, any questions, go to stagesoflifemedicalinstitute.com. Dr. Klein and I will be back next Sunday to do it all again at 4. Say goodbye.
Goodbye.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out Stages of Life Medical